We've actually entered an era of medicine that honestly would have seemed unimaginable. We now have tools that allow us to directly influence biological signals inside the body. And these tools fall into what many people call the world of biohacking or regenerative medicine. The goal is not hacking the body, it's stimulating the body's natural healing mechanisms that already exist.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Hey there, welcome back to Health Decoded. I'm your host, Dr. Alessi, and today we're going to talk about something that I believe represents the true future of medicine, and it may not look exactly like what most people expect. When people think about the future of medicine, they often imagine more technology, more diagnostics, more drugs, machines, and technology absolutely plays an important role. We now have incredible tools like regenerative peptides, soft wave therapy, PEMF technology, advanced functional lab testing, precision nutraceuticals and vitamins. These are powerful innovations that allow us to stimulate healing pathways inside the body in ways that weren't possible 20 years ago. But here's the interesting thing. At the same time that medicine is becoming more high-tech, it's also rediscovering something incredibly old. Ancient healing traditions, practices like Ayurvedic medicine, traditional Chinese medicine, herbal medicine, breath work, circadian living, and energy-based therapies. These are systems that have been around for thousands of years. And what's fascinating is that when we look at the science today, many of those ancient practices were actually describing real biological processes long before we had the technology to measure them. So the future of medicine may not be purely modern and it may not be purely ancient. The future of medicine may actually be the intelligent integration of both. Today, we're going to explore how these two worlds, modern regenerative medicine and ancient healing systems, can combine to create dramatic results in human health. So let's get right into it. First off, let's talk about what the problem is with modern medicine. So let's begin with an honest assessment of the current healthcare model. Modern Western medicine is an incredible achievement of human science. Nobody's taking that away. It has saved countless lives, and when it comes to acute care, it is arguably the most powerful medicine system humanity has ever developed. If someone experiences a traumatic injury or a severe infection or a heart attack or some type of surgical emergency, there's no question that modern medicine is extraordinary. The development of antibiotics, advanced surgical techniques, and trauma care has dramatically increased survival rates across the globe. For example, the mortality rate from a bacterial infection like pneumonia or sepsis used to be devastatingly high before antibiotics. Today, thanks to advances in pharmacology and emergency medicine, survival rates have improved. The same is true in trauma care. So according to research published in the Journal of Trauma and Acute Care Surgery, improvements in trauma systems and surgical protocols have reduced mortality from severe injuries by 30% in many developed countries. So again, to be clear, modern medicine is incredibly powerful. But here's the key distinction. The modern healthcare model was designed primarily for one thing, to treat acute disease. It was not designed to solve or prevent chronic illness. And chronic illness is now the dominant health challenge of our time. According to the CDC, according to the Center for Disease Control and Prevention, roughly 6 out of 10 adults in the United States now live with at least one chronic disease, and 4 out of 10 live with 2 or more. These are things like metabolic syndrome, type 2 diabetes, autoimmune disease, cardiovascular disease, chronic fatigue syndromes, hormonal disorders, and neurodegenerative disease. These are not conditions that appear overnight. They slowly develop, often 10, 20, or 30 years in the making, and they rarely have a single cause. Instead, they're going to emerge from complex interactions between your genetics and your environment, your nutrition, your gut health, inflammation, stress, exposure to toxins, and the way that your sleep and circadian rhythm gets disrupted. In other words, these are systems problems, and systems problems require systems thinking. But historically, the dominant approach in modern medicine has been much more linear. The model often looks like this. Patient develops a symptom leads to a diagnosis, Diagnosis leads to a medication, and sometimes that medication works very well at reducing the symptom. But reducing a symptom is not always the same as restoring health. For example, if someone has high blood pressure, a medication may lower that number, but the medication does not necessarily address why the blood pressure rose in the first place. Was it from chronic inflammation or insulin resistance? Was it from stress physiology? Was it endothelial dysfunction or a nutrient deficiency? Those questions are often left unexplored. Another example is autoimmune disease. In autoimmune conditions, the immune system mistakenly attacks the body's own tissue. Conventional treatment often involves suppressing the immune system to reduce the symptoms. Sometimes that's necessary for short term, but suppression alone doesn't always answer the deeper question. Why did the immune system become dysregulated in the first place? Was it triggered by gut permeability or a microbial imbalance or a chronic infection? Was there some type of toxin, chronic stress, or deficiency in a nutrient? Those upstream drivers are rarely addressed within a symptom-based model. And so this is where the conversation around functional medicine begins to emerge. Functional medicine asks a different set of questions. Instead of asking what drug treats this disease, it asks what physiological imbalance created this condition? And more importantly, what can we do to restore the body's natural regulatory systems? This approach is often described as looking at the terrain of the body. The terrain includes things like your gut microbiome, your immune system, your hormone signaling, mitochondrial energy production, detox pathways, and nervous system balance. When the terrain becomes disrupted, disease often follows. And what's fascinating is that this idea of biological terrain is not new. In fact, it's been central to many ancient medical traditions for thousands of years. Systems like Ayurveda and traditional Chinese medicine were built around the concept that health depends on maintaining balance within the body. They didn't frame it in terms of cytokines, mitochondrial function, or microbiome diversity because they didn't have the tools to measure that yet. But they were observing patterns. They recognized that your lifestyle, diet, stress, environmental exposure, they all shape the body's internal balance. And they focused heavily on restoring that balance before disease became severe. In many ways, these ancient systems were practicing preventative systems medicine long before modern science had the technology to measure what was actually happening. So today we're beginning to see these worlds converge. Modern medicine and modern research is increasingly validating the importance of things like your microbiome health, inflammation, circadian rhythm alignment, and nutrient sufficiency, as well as the physiology of stress, all of which were emphasized in traditional healing systems, and that realization led us to an important conclusion. The future of medicine may not lie exclusively in modern tech, and it may not lie exclusively in ancient tradition. Instead, I believe the most powerful approach may be the intelligent integration of both, using modern science to understand the biology while applying the wisdom of ancient systems that recognize the importance of balance, lifestyle, and daily health maintenance. And that intersection where cutting-edge regenerative therapies meet time-tested healing principles is exactly where medicine is headed next. So let's get into ancient medicine, thousands of years of observational biology, and how that has affected the way we approach things nowadays. So if modern medicine, as we said, is excelling at acute intervention but struggles with chronic disease, it's going to raise an interesting question. What systems of medicine were designed to manage long-term health and balance? When we look back through history, we find several traditions were built exactly for that purpose. Two of the most influential, and two that I practice, are Ayurvedic medicine, which originated back in India over 3,000 years ago, and traditional Chinese medicine, which dates back more than 2,500 years. Now, at first glance, these systems may seem completely different from modern Western medicine because they're going to talk about concepts like qi or life energy, meridian pathways, doshas, yin and yang balance. And understandably, those concepts are abstract and can sound woo-woo to most people. But when modern science began studying these practices more closely, something fascinating emerged. Many of these ancient frameworks were actually describing real biological processes, just using a different language. So for example, take the practice of acupuncture. For centuries, acupuncture was explained through the movement of qi along meridian pathways. Modern research now shows that acupuncture can influence nervous system signaling, inflammation pathways, the release of endorphins, and blood flow regulation. And there's a review published in the Journal of Pain that found that acupuncture significantly reduces chronic pain conditions, such as osteoarthritis, lower back pain, compared to standard care. There's even functional MRI studies that have demonstrated that acupuncture can alter activity in the brain regions that are involved in pain perception. So another awesome example is herbal medicine. Traditional Chinese medicine has used botanical compounds for thousands of years, many of which modern pharmacology has been based on. And so modern pharmacology has begun studying these herbs and identifying the active compounds that influence physiological pathways. Great example, one that we use all the time, is berberine. Berberine is found in plants like coptis and golden seal and has been shown in studies to significantly improve insulin sensitivity and blood sugar regulation. In fact, several studies found berberine to perform similarly, if not better, to the drug metformin in certain metabolic markers. Ayurvedic medicine offers another great example. It places an enormous emphasis on digestive health, something they refer to as Agni, or digestive fire. Modern medicine is now discovering that the gut microbiome plays a central role in immune regulation, inflammation, hormone metabolism, and brain function. And research published in Nature Reviews of Gastroenterology showed that disturbances in the gut microbiome are associated with conditions ranging from autoimmune disease to depression. So when Ayurvedic practitioners spent centuries focusing on digestion as the foundation of health, they were actually observing something very real. They just didn't yet have the tools to measure the gut microbiome. Another awesome principle that modern science has rediscovered is the importance of circadian rhythms. Traditional healing systems always long recommended aligning your daily routines with the natural cycles. Wake with the sunlight, eating during daylight hours, and sleeping shortly after sunset. Today, we know that the circadian rhythm can regulate hormones, metabolism, immune function, mitochondrial function. There is great research from the Salk Institute and Harvard Medical School that showed that circadian disruption, such as irregular sleep schedules or late night eating, significantly increases the risk of metabolic disease. So when we take a step back and look, something remarkable is aligned. Ancient medicine, through centuries of observation, recognized patterns that modern science is now beginning to understand through testing. And so these traditions were built around a central principle. Health is not the absence of disease. Health is the presence of balance within the body's systems. Maintaining that balance then requires daily practice that supports the body's natural and regulatory mechanisms. But while ancient medicine excelled at understanding patterns of health, it lacked what modern medicine excels at: powerful technology. And that brings us to now the other side of this conversation. So now let's get into modern biohacking and regenerative medicine and the cool tech stuff that everyone's so interested in nowadays. But before we do that, let me pause for a quick message from one of our sponsors, and we'll be right back. Hey, busy professionals and parents, let me ask you something. Do you need help with your low energy, stubborn weight, brain fog, gut issues, or hormones, but you don't know where to start? Well, you're not alone. And the biggest problem is that modern healthcare is designed to diagnose disease, but often misses the dysfunction that begins years earlier as under the surface symptoms. That's exactly why I created the Functional Medicine Starter System. This is a structured, physician-led process designed to uncover what is actually driving your symptoms, whether it's rooted in gut health, metabolic function, inflammation, nutrient status, or hormonal imbalance. No guessing, no generic protocols, just real data and a clear plan. So if you're tired of searching for answers, but you're not sure how to begin solving your health issues, go to the link in the podcast show notes to learn more about the Functional Medicine Starter System. Because once you have clarity, you can finally start to feel like yourself again. Now, let's get back to the episode. All right, welcome back. So let's get into the other side of the coin here. Modern biohacking, regenerative medicine, high-tech interventions for influencing health. And over the last 2 decades, we've actually entered an era of medicine that honestly would have seemed unimaginable. We now have tools that allow us to directly influence biological signals inside the body. And these tools fall into what many people call the world of biohacking or regenerative medicine. But the goal is not hacking the body, it's stimulating the body's natural healing mechanisms that already exist. One of the most exciting developments is actually something called peptide therapy. And if you're not familiar, peptides are short chains of amino acids that act as signaling molecules throughout the body. Think of them as biological messengers. They're going to tell cells when to repair tissue, when to reduce inflammation, produce growth factors or growth hormone, or activate immune response or activate immune responses. Certain peptides have become particularly well known in regenerative medicine. For example, one of the most popular is BPC-157. This is a peptide originally derived from gastric proteins in the gut, has been studied for the ability to support the healing of tendons and ligaments and connective tissue. Animal studies in the Journal of Current Pharmaceutical Design and Peptides showed that BPC-157 can accelerate healing in damaged muscle and tendon by enhancing angiogenesis, which is the formation of new blood vessels. Another awesome peptide is TB500. This works by influencing protein called thymosin beta 4, which plays a role in cellular migration and tissue repair. So these peptides aren't replacing your body's healing processes. Your body is going to do that. They just amplify them and speed that process up. Then we have technology like soft wave therapy, something we work with a lot within our clinic, which is a form of acoustic wave therapy, similar to an ultrasound. Soft wave uses high energy sound waves to stimulate tissue repair. When these waves interact with the tissue, they create a biological response that is going to increase blood flow, increase stem cell activation, collagen production, and reduce inflammatory signaling. Clinical studies have also shown that acoustic wave therapy improves conditions such as plantar fasciitis, chronic tendon injuries, and joint pain. Another cool technology, something we use a lot as well, is PEMF, or pulsed electromagnetic field therapy. So PEMF works by applying low-frequency electromagnetic pulse to the body. These pulses, they influence cellular electrical activity and mitochondrial function. And there's research from the journal Bioelectromagnetics and Orthopedic Research shown PEMF therapy improves bone healing, tissue regeneration, and inflammation reduction. In fact, PEMF is FDA approved for bone fracture healing for the last decade. And what all these technologies have in common is that they aim to stimulate regenerative biology, so the body's ability to repair. They activate pathways that the body already possesses, but the critical point people miss is that they work best when the biological terrain is healthy. And so if someone has nutrient deficiencies, gut inflammation, metabolic dysfunction, they are having poor sleep or a high toxicity, a high burden of toxins in the body, their ability to respond to regenerative therapy is going to be limited. So you can stimulate healing pathways, but if you lack the resources or the raw ingredients to execute those repairs, your progress will still be slow. This is often where we find that patients are missing when they're going through some type of healing journey. They have back pain, joint pain, knee pain, whatever it may be. They've been to chiropractors, physical therapists, all kind of stuff, massage therapy, and they get temporary relief, but nothing's actually working. And that's because their internal system is not allowing their body to integrate that healing. And so the integration comes from using the wisdom of ancient systems to support the body's foundational balance. That's the internal, while using modern regenerative technology to accelerate that healing and recovery. When those two worlds come together, we see something remarkable. We move beyond treating disease and begin engineering resilience. And that is a term we use in our clinic all the time. We are trying to improve the body's resilience. How do we make it so that you don't need to do these things forever? Your body can then operate, manage, and do what it needs to do for a long period of time. And so the integration is where the future of medicine really lives, right? So now this is the most important idea of this entire episode. So if you take away nothing else, if ancient medicine provides wisdom about balance, lifestyle, and prevention, and modern medicine provides powerful tools to stimulate healing and regeneration, then really the real breakthrough happens when these two systems are combined, because each one solves a problem that the other can't. Pause. Kyle, let me redo that. because each one solves a problem that the other cannot solve alone. Ancient healing traditions are going to excel at creating the right environment for health, focusing on things like sleep and circadian rhythm, breath and nervous system regulation, nutritional and digestive strength, using herbal compounds that support your physiology, movement practices, seasonal environmental alignment. In other words, they support what we call the biological terrain, the internal environment in which your cells live and operate. If that terrain is healthy, healing happens more easily. Think of it like this. You're trying to build a house or you're renovating a house, but the foundation, the ground on which that house is built on is not appropriate. There's dysfunction to it. It's not healthy. You need to basically work down to the bones, and you need to reset that. You need to rebuild the foundation so that then your build can be ideal. Because if the terrain is inflamed or toxic or metabolically dysfunctional, healing becomes difficult. This concept is actually supported by a lot of research too. And so, for example, I pulled this study published in Nature Reviews Immunology. It showed that chronic systemic inflammation disrupts nearly every major biological system in the body, including your hormones, your mitochondria, immune system, and tissue repair. So even if we introduce powerful therapies, things like soft wave, peptides, if the terrain is not prepared, they are not going to work as optimal. And this is where ancient medicine has enormous value, because ancient systems, they also had limitations. They lacked the ability to intervene quickly and precisely when the body needed stronger stimulation. And this is where then the modern regenerative medicine comes in. So here's a real world example, right? Imagine a patient dealing with chronic knee pain. See this all the time. In a purely conventional model, the treatment pathway probably looks like this. They have pain, so they get an anti-inflammatory medication, maybe an injection, they do some physical therapy, and they possibly have surgery. But in an integrative model, the thinking becomes much broader. First, I'm going to ask some questions. Number 1, is there structural damage in the joint? Number 2, what is the inflammatory environment of the body? Number 3, what is the regenerative capacity of the tissue? And number 4, what lifestyle factors are possibly preventing healing? Now, in an integrative model, the treatment might look like this. Soft wave therapy to stimulate tissue regeneration and stem cell activation. PEMF therapy to improve mitochondrial function and cellular signaling. Collagen and amino acid support to provide building blocks for connective tissue. Anti-inflammatory nutrition to reduce systemic inflammation. Some powerful herbal compounds like curcumin or boswellia supporting that inflammatory balance. And then movement and mobility practice to restore biomechanics. Each of these interventions supports a different part of the healing process. The technology stimulates that regeneration, whereas the lifestyle and nutritional practices support the body's ability to execute that repair. Together, then, the effect becomes much more powerful. Another example comes more let's think more on metabolic health. Somebody with metabolic syndrome, maybe they have insulin resistance, chronic inflammation, disrupted gut microbiome, poor sleep quality. In the conventional model, treatment might involve medications for blood sugar or cholesterol, but in an integrative model, we look at the entire system. We would probably combine advanced lab testing to understand metabolic signaling, targeted nutraceuticals to improve insulin sensitivity, gut restoration, circadian rhythm alignment, resistance training to improve glucose metabolism. And in some cases, we may even use peptide therapies to support metabolic signaling and tissue repair. When these approaches are combined, the body begins to move back toward metabolic stability. And what we often see in these cases is not just symptom relief, but a true shift in the underlying physiology. And we've seen it in our clinic. People go from type 2 diabetic diagnosed to non-diagnosed. And this is what I believe is the future of medicine. It's going to look like this, not just pharmaceuticals, not just natural medicine, but precise integration where we use the best available science from every discipline to support the body's natural intelligence. Because the human body is not a machine with replaceable parts, although some may think that. It's an incredibly complex biological ecosystem. And ecosystems thrive when the right conditions are created. The concept is sometimes referred to as systems medicine or integrative longevity medicine. The goal is not simply to extend lifespan. The goal is to extend health span. And this is where the mental shift needs to happen. We don't just want to live longer if living longer means we're going to be in a chair an invalid, but we want to be healthy longer. Even if we don't live as long, can we live as well as we can into those older years? And to help people maintain physical strength and metabolic resilience, cognitive clarity, structural integrity, and emotional balance for as long as possible. And so when we zoom out, what we can see is something remarkable happening in healthcare right now. And I do believe that at Ascend Functional Health, we are on the forefront of this, because modern science is beginning to validate what ancient traditions already knew. Health is not just about treating disease. It's about maintaining balance across systems of the body. And so what we do is we combine modern diagnostics, regenerative technology, nutritional biochemistry with the ancient lifestyle principles. We create a model of medicine that is far more powerful than either system alone. And this is where we're headed. In many ways, we're only at the beginning of this transition, because the more we learn about the human biology, the clearer it becomes that the body already possesses incredible healing capabilities, and we are learning every single day. Our job is simply to remove the obstacles and provide the right signals. When we do that consistently, the body often responds in ways that can be remarkable. And so in closing, that was a lot of depth to that episode, and I hope this is something that can help change the way that you're thinking, help give you a shift in your mindset as to how you approach your health and your balance of your systems. And if we zoom out and look at the trajectory over the next 20 or 30 years, the systems that will dominate are those that combine advanced diagnostics, regenerative tech, and personalized nutrition with the ancient healing principles. And not just because it's trendy, but because it works. And the future of medicine is not just about treating your disease, but again, about engineering resilience, helping your body maintain strength, clarity, musculoskeletal integrity, and immune intelligence for as long as possible. So again, I want to thank you so much for joining me on this episode of Health Decoded. If you find value in this episode or any of our episodes, please follow, like the show, subscribe, and share this with someone who's interested, because that's how we get the message out, and that's how we're able to help more people take back control of their health. If you want to learn more about our functional and regenerative medicine programs, you can visit our website, alessifunctionalhealth.com, schedule a consultation, check out our newsletter, any of our resources that we have, and make sure you subscribe to the show so you never miss anything. So thanks again for tuning in to Health Decoded. I'm Dr. Alessi, and I'll see you on the next one.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.